Good morning, Halifax County Schools. Good morning, Dr. Battle. How are you?
Good morning. Good morning, sir. How are you?
I'm doing well. You know, it's time to get back to school, isn't it?
Yes, back to our same routine with sweet tea with Dr. C.
So welcome back, everybody. Get your 5 fingers up when you see Doc C. Yes. We're back to you with sweet tea with Dr. C. We have a lot of good news that we would like to share with our Halifax family today. You know, Dr. Battle, we're officially back to school. We started, when did we open up?
Was it in March?
Yeah, we opened up in March.
In March of last year. You remember the students, they missed an entire year. From March to March. And
we were totally virtual.
That's right.
That's right.
And so then we came back to school in March. So I think, you know, I calculated, there was like 81,000 minutes, instructional minutes that students missed.
Virtual.
Yes.
81,000 minutes were missed face-to-face.
Yes.
Wow.
And so we came back in March.
Yes, we did.
And ironically for us, because we realized that our students need that instruction, we went during the summer with the cohort as well.
So we started in March. We had an outstanding virtual graduation. We had in-person graduations.
It was in person.
Yeah, they were in person.
Absolutely.
See how we're going back and forth with COVID and the new normal. So we had a wonderful, outstanding, one of our best graduations. Right?
Right.
You know, we set new records, new highs with our graduation rate, correct?
84%.
84% graduation rate in Halifax County. Whoop, whoop. That goes to all of us. And when you look at the empowerment zone, they had their largest ever, didn't they?
Yes, they did.
They sure did.
Shout out to the empowerment zone.
And then we flowed right into the summer.
Yes.
And we had about 500 kids come in during the summer, didn't we?
Yes, and they were very eager to be here.
We had a nice time over the summer. And then we took a little time off. We fixed up our places. We fixed up our facilities. And then we opened back up on August the...
Was it the 25th? 23rd?
23rd. Okay. Yeah, August the 23rd, we rode our buses and we officially opened back to school for face-to-face instruction. So how do you think it's been going so far?
Well, if I judge from our stakeholders, I think it's been going very well. I think our stakeholders realize that we really breathe life into being ready, resilient, proficient, triumphant, and our students really exemplifies resiliency.
Yeah. You know, we have a hard time remembering dates because we never stopped.
That's right.
We never had a break this year. We really didn't since COVID. We just been rolling on the river. We just been rolling and rolling and rolling. And I like to say great job to our principals, our students, our staff, and our Halifax County Schools family. And I like to thank our parents for their cooperation. You know, we have a lot of processes and protocols that are in place, aren't they, Dr. Battle?
Yes, absolutely. Absolutely. And that's part of the thing that we have with the school safety piece. Because, you know, when we talked about returning back to face-to-face learning, you know, safety was that first point. We wanted everybody to be safe in addition to that academic piece that we were responsible for, that we are responsible for. Safety was the number one thing. And so in order to do that, we had to establish coherent processes and procedures so that everyone would know what the expectations are and they would recognize what their role is, and we could actually all be on one accord.
So we had all of our teachers come in for our convocation.
Yes.
Right?
Yes.
And it was wonderful. It was at Enfield Middle.
It was at Enfield.
And we had a wonderful time. All employees were invited to Enfield Middle, and we just had a ball. And then when they left on the last day, we had a band out there playing in the lawn, did we not?
Right. Jazz on the lawn.
Jazz on the lawn in front of Enfield Middle. And it was a wonderful way to open school for the year, wasn't it?
Yes.
And our theme this year is slow and steady. Families, you know, we're going into what we call part 2, phase 1 of our COVID journey. Part 2, phase 1. This is the second year of this journey. And if we were all on the Starship Enterprise, I would think that we're going into an asteroid belt. Visualize Starship Halifax going into an asteroid belt, and we're surrounded by all of these asteroids. And what we're trying to do is go slow and steady.
Slow and steady.
As we roll through the asteroids, because we just don't know what will slip through and ding us. Now, in order for us to be successful this year, the word is coherence, isn't it?
Yes.
And what does coherence mean to you, Dr. Battle?
So when we talk about coherence, we're thinking about everyone aligning their resources and adhering to those things that put us all on one accord, operating in one body and one voice.
One body, one voice, one sound.
The ultimate sound
The
machine.
ultimate sound machine.
Yes.
One body, one voice, one sound. And that's how we're making incremental growth in Halifax County. Not superstar. I mean, we're just making step-by-step growth. Now, what does that mean in Halifax? That means we're better than we were yesterday.
Absolutely.
And every day, all we're striving to be is better than we were the day before.
Mm-hmm.
And those processes and protocols that we have in place are being executed well, and it's pushing Halifax slow and steady and to speak with one sound.
Yes, and you know, if we wanted to make sure that everyone was aware of those processes and protocols, you know, we actually have a web page that has all of that information up there so that parents and the community and our stakeholders, you can see how you can help support us in this endeavor.
Yes, yes. So what are some things that we have in place right now to maintain safety in our district? Number one, we have mandatory masks. Am I right, Dr.
Mandatory masks.
Mandatory masks. Everybody has to wear your mask in every building in Halifax County Schools, especially when we can't social distance. Now, if you're in a room by yourself, that's one thing. Or if you're adequately social distance, that's another thing. But when we're together, we have to have our mask on. Those masks are actually saving lives. Why is it saving lives? And we're going to talk more about it with our guest, our special guest, Dr. Anita Jackson. It keeps the droplets to you. That's all. Keep your droplets to yourself. That's pretty much what we're talking about. And we just don't want to be spraying everybody like we used to before masks, because those droplets may have the virus in it. So we're asking everyone in Halifax County Schools to wear your mask, and masks are mandatory. Social distancing to the greatest extent possible. Last year we were trying to push everyone to 6 feet.
Right.
But what we learned is that with those masks on, you don't have to do it.
Right.
You don't have to be so regimented. But we do believe that we do need to keep ourselves socially distanced to the greatest extent possible,
right,
while you're still wearing your mask. And the next thing that we're doing, we're disinfecting our classrooms frequently. Don't all of our teachers, don't they have a Lighthouse toolkit?
Yes, we call it the Lighthouse toolkit.
Mm-hmm.
And in that Lighthouse toolkit, we provide them with the hand sanitizer, the hand squad that they need in order to sanitize the desks. We provide them with masks, gloves, all those things that they would need in order to be in a defense mechanism as it relates to that.
Absolutely. So everyone is equipped personally.
Mm-hmm.
We have mandatory masks.
Mm-hmm.
We're socially distanced to the greatest extent possible. And, Halifax County being a responder to the waves.
Yes.
And we do so. We've added another layer, a fourth layer to our safety protocol, and that's COVID-19 testing,
Really?
which will be discussed later on. And we rolled out COVID-19 testing across the entire district.
Go Halifax!
In Halifax, we take lemons and we turn it into lemonade. And we want our lemonade to be sweet in Halifax County. And, Dr. Battle, we even have what we call collectors, don't we?
Yes.
And some of those collectors are actually students in Halifax County Schools, are they not?
Yes, so Dr. Cunningham, the most strategic thing about this is whatever opportunities we bring to Halifax County, we try to look at ways that we can leverage it for our students. Mm-hmm. And so we strategically looked at the COVID-19 and the needs that they have in terms of the testers and the collectors. Mm-hmm. And what we said, okay, so we have students at our early college or in our high school who can meet this criteria once we give them the training. And so once we give them the training, that can become part of their community service project. Mm-hmm. And we can give them a local credit for that. Mm-hmm. They can get the training.
Bam.
They can also get some compensation.
They get paid.
Yes. And they can help out the community. A civic duty.
A civic duty. Now think about this. That is called turning lemons into lemonade.
Absolutely.
And we're making it sweet.
Mm-hmm.
We've done this with everything. We started with the help desk program.
Yes.
We contracted with the $40 insurance fee,
That's right.
and we're taking the $40 and we're actually buying the replacement parts, right?
Mm-hmm.
And we're actually teaching the students to become certified in repairing our computers.
Wow.
And last year, we repaired over 500 devices.
500.
Our students practiced on 500 devices. And then, parents, I want you to think about it, because we published what those parts cost in your manual. Go look it up for yourself.
That's right.
Not one thing the power cord is the only thing on that price list that's less than $40. That's it. Everything else would have had to been covered by the parent. So 500 parents, we had 500 breaks,
Mm-hmm.
and because of that $40 insurance program, parents didn't have to pay but $40 one time. Am I right,
That's right.
Dr. Battle?
That's right.
And that's called that. Yeah, it's insurance just in case.
Mm-hmm.
Now, I know my children, and you know your children too. Sometimes we just break things just because. And it pays to have a solution in place that deals with those breaks that are happening frequently across the district. Am I right, Dr. Battle?
Absolutely.
And we call that the Halifax way. It is never our intention to put our parents in a financially oppressive position. It's hard out there. It is already hard out there. So why would I want to send bills home for $150 per break, $80 per break, $60 per break? Why would we want to put you in that position? You pay me to come up with better solutions that does not put an undue burden on our parents. You pay me to do that. And all we're asking is that we all chip in, and then we're taking that pool of knowledge and we're transferring it to your children. We are training our own geek squad. Our own geek squads. And you should see our children in that room working on those computers, which will ensure that a Halifax graduate never makes minimum wage again. See, that's our goal, families. That's our goal. We're out of the minimum wage business. When you earn your sound basic education in Halifax County, we want your hourly wage to go to at least $15 an hour. That's our goal. And together, we're actually doing it. So we've aligned that same practice with our COVID-19 testing, correct? We have scholars. Now hear me, scholars. Doc C's always watching. And I'm looking at you. And those who are doing right, making excellent grades, you might get pulled for an apprenticeship program. Mm-hmm. And you might benefit as well. Am I right, Dr. Battle?
You're absolutely right. And Dr. Cunningham, I'm reflecting to our summer program, things that we did in the summer, and just to give some more credence to the information that you're sharing, we had the Lighthouse Solar Camp program. And with the Lighthouse Solar Camp program, we had students, exactly 20 students, Halifax County School students, who were afforded the opportunity to earn credentials during the summer. And with that, they were afforded the opportunity to earn a little money with that as well. And so we are constantly looking for partners that will see the light that our students have. I'm thinking about Apple when you were talking about the Geek Squad.
We're trying to get to Apple.
Yes.
We hear that they're coming to Raleigh.
Yes.
And we want some of our scholars working right there.
That's right.
We want some of our scholars working in Amazon, where they just announced this brand new benefit. Did you hear about that benefit in Amazon?
I did not. Tell me all about it.
They're adding a brand new benefit in Amazon where all of their employees can go to the university free.
Free. Tuition.
Free, tuition free. Mm-hmm. Now, I want our scholars working in places like that.
That's right.
Where you're getting robust benefits, but you have to be certified in order to be qualified. And that is exactly how we're pushing our scholars from Halifax County. And we all have a role to play. So as we look at the waves that continue to roll in Halifax County, we're looking at how we respond to those waves.
Absolutely.
And parents, we all must work together. We all must work together. We all must work together. And that includes that bus. Parents, the bus transportation that's provided every day is a privilege.
It's a privilege.
And what's a privilege, Dr. Bowser?
A privilege is something that you don't necessarily have to have. It's just a privilege. is something that we give to you. But if you abuse it, we can take it away.
That's right. It's not a right. And that's the difference between a privilege and a right. See, a right can't be taken, but a privilege can. Parents, I need you talking with your son, your daughter, your children about proper bus etiquette. Come on. I need your son. I mean, we're in perilous times now. We're in troubling waters. We're in the asteroid belt. I need you to respect that bus driver every day. Think about what's under their charge at 6 o'clock, 7 o'clock in the morning.
Yeah.
They're transporting our most precious cargo, our children, to school. And then they're bringing them home. I need you to crack down on your son or daughter and say, you need to behave on that bus. Do not have the privilege of riding the bus taken away. It's just like with the Chromebooks. Why would a principal have to pull your son or daughter off the bus for 2 weeks and you will have to take them, am I right?
That's right.
And pick them up during that bus suspension. That is not the Halifax way. We all work together here. And everybody strives for 5 in Halifax County. So scholars, I'm telling you right now, I want 5-star behavior, 100%. 5-star behavior on the bus every day, right? But today we're going to be talking about a hot topic. And the hot topic for discussion today is about remote learning. Senate Bill 654.
Yes.
And that's the bill that we're under right now. Senate Bill 654 and remote learning. And today we're going to focus on everything that you need to learn about Senate Bill 654. What it is and what it isn't. Now, what is Senate Bill 654? Senate Bill 654 governs what we're doing now. Now, let's just talk about it in simple terms, family. I get questions all the time. Dr. C, why can't we go back to Plan C? Why can't we go back to Plan C? Full virtual right now. 100% full virtual. Well, it's just like wearing a seatbelt. If everybody isn't doing it, if everyone is doing the same thing, there must be a law that says what we have to do. You don't see any schools right now going full virtual. Any school districts rolling out going full virtual. Do you, Dr. Matt? No. That means because of the Senate Bill 654, we're not able to go full virtual like we used to. One thing that we learned last year, clearly, is that our scholars learn best face-to-face. Federal, state, and local, all of them agree that scholars learn best face-to-face, especially in Halifax County, where we had connectivity issues every day. We had kids, we had students, right?
Yes.
I mean, we handed out almost 1,000 hotspots, over 800 hotspots, did we not?
We did.
And some of those hotspots did not work because we didn't have a cell phone signal. So why would I put that burden again on parents and say, we're going to go 100% virtual, knowing that you live in a desert where you're unable to log on every day? That means your son or daughter will continue to lose those 81,000 minutes.
Instructional minutes.
And they will be further behind in Halifax County. And we're in the business of closing deficits, not expanding those deficits. So Senate Bill 654 is the bill that we're operating under. Now, we can close schools, can we not, Dr. Battle?
We can, Dr. Cunningham, for a specified period of time.
For a specified period of time, but there also must be a reason, like inclement weather. So think of Senate Bill 654 as with inclement weather. And so an inclement weather or an emergency like COVID, the positive spike, which will allow me the ability to close temporarily up to 2 weeks. If you're looking at your newspaper, if you're reading RR Spin, you're starting to see press releases from school districts that are closing temporarily up to 2 weeks. And that allows us to desanitize and to assess our conditions. And then when we do close temporarily, we're still under instruction, correct?
That's right.
And what is it
right.
called?
So when we close temporarily, we're under what we call RALO.
RALO.
Remote Alternative Learning Opportunities for our students. And so when you look at the RALO alternative, with that you have 3 categories, Dr. Cunningham. So the first category would be those students or districts or classrooms that are impacted by COVID-19. Okay, so in that particular instance that you just gave, that would be a RALO instance. Okay, the second category would be homebound students or students who are medically fragile. And in most cases with that, that's dictated by what we call their individualized education plan. Okay, and then the third category would be those students in the high school who are on virtual public schools or virtual learning. And so I want to talk a little bit about that because we want to peel that back just a little bit, just to kind of get some things straight with the vocabulary. So when we talk about remote learning is any learning that does not happen in the school building. Okay, so that's what that remote learning is. And under that remote learning piece, it could be virtual or not. Okay, virtual is just one of the components under that remote learning piece. But what I want to explain to parents as it relates to the remote learning piece is only for a specified period of time. It's not meant to be long-term, but it can be if that student is medically fragile. Okay, so we want to kind of go through and we're going to peel back the layers with that, and we're going to actually go through an example of some of our teachers who are doing an outstanding job with RALO in their classrooms, just so parents will understand what happens from the time that you go out to the school, meet with the principal about the RALO opportunity, to the time that instruction is actually facilitated for the student. Then basically with the RALO situation, because it's short term, the parent winds up kind of doing a lot of the heavy lifting in terms of the instructional piece with the support of the teachers doing office hours.
Just like last year.
Yes.
Well, a little bit different from last year because, and that's what I want to clarify. When we temporarily close a school for 2 weeks, all employees will still be required, just as we did last year, to report to school.
Right.
Teachers will report to their classrooms, and instruction will then continue. That's why we gave out the Chromebooks, because you will then log in to the teacher's classroom. Am I right?
That is correct.
For that closing period. What Dr. Battle was talking about is RALO,
yes,
which is outside of the closing. And she is going to demonstrate how to access RALO. See, now the guidelines for RALO, are they embedded in Senate Bill 654?
It is embedded in Senate Bill 654. And as a matter of fact, we will also show to our stakeholders a correlation between Senate Bill 654 and the Halifax County Schools RALO plan, so that you can see what's the compare and contrast. So you can see those things that are like, and then those things that we are making unique to just Halifax County Schools so that we can meet the needs of our students.
So temporary closure for 2 weeks, you log online.
Yes.
You use your Chromebook, and we log online. Teachers report to the school, just like we did last year. RALO is a little different, that Dr. Battle will demonstrate on how to access RALO.
Yes, and you know, Dr. Cunningham, when we talk about RALO, we want to talk about, you talked about the Chromebooks, and the beauty of the Chromebooks is that all of our teachers have web pages, okay? And so you talked about that internet desert that we may have that exists out in the corridors of our counties. And I also want to kind of talk a little bit about what happens when we go to those Chromebooks and we do not have internet connectivity in those areas. And so just to kind of talk with the public about how strategic the leadership is in Halifax County Schools, Dr. Cunningham, think back with me now. Let's go back in time. March 13th, when the governor first said that schools would close.
Yeah.
You called, you assembled your team, and what did you say?
We have to keep pushing forward.
We have to keep moving forward.
Right.
And at the front of that era was school safety.
Right.
And we vowed that we would keep everybody whole, which included our bus drivers and our school nutrition workers.
Right. We had food on the street the next day.
Bam! That's what I'm talking about.
We had food on the streets the next day, handed out meals.
Being responsive.
Yes.
So when you think about the strategic leadership that we have, and you think about the current reality that we have now with Senate Bill 654 and when we go to remote instruction, we have already devised a plan for those deserts. So Dr. Cunningham, the plan is something like the school buses will still run.
They still run.
Now, on those school buses, what was strategic about them?
We had so much on it because we believe in alignment. We had the food, we had packets, we had everything you needed to know on that bus, and we were delivering it according to the regular bus routes.
Right.
So that kept everyone working. Our food service was able to continue working because they were preparing the meals. Our bus drivers were able to continue to work because they were driving. Our teacher assistants were able to continue to work because they were monitoring. Our teachers were able to continue to work because we were instructing.
Right.
The whole engine continued to push Halifax forward.
Yes. And the part that we added to that were the Wi-Fi rangers.
Oh, yes.
You remember in the schools, it started out, we had the Wi-Fi rangers that were at the school buildings, but then we realized we could commission them on the buses.
We electrified the buses.
Yes.
And we turned them into mobile hotspots. And we were positioning those Wi-Fi rangers everywhere throughout the county.
Right.
Like in Scotland now.
Right.
Like in Hollister.
That's
like
right.
in Ringwood.
Uh-huh.
Those deserts out there.
Right.
And we parked that bus and everybody was able to hit it and didn't even understand how they were doing it. It was that school bus that was equipped.
So think about it, Dr. Cunningham, and think about it because you're very strategic. We tried that during that little time, right?
Mm-hmm.
And we recognized, okay, we're onto something here.
Mm-hmm.
So now that we realize that we serve a community that has an internet desert,
mm-hmm.
but we have a vessel that can go into those deserts,
mm-hmm.
the school bus.
That's exactly right. That mobile hotspot.
That's right.
That's strong and powerful.
That's right. So what happens is when the buses are delivering those meals to where the cell towers can't even
That's
get,
right. That's
Halifax
right.
County Schools can reach it because our Wi-Fi ranger is there, and that Chromebook
hits that network and gets updated immediately because it's on our network.
Absolutely.
So we really don't need paper and pencil packets like we used to. We've learned how to utilize our local area network to make sure that the information is already downloaded to your Chromebook.
Absolutely.
All you're hearing is a bing, like on your cell phone. You're like, what in the world going on? You're being uploaded on that device.
Right. And so when people say, well, why does pre-K or why do the kindergartners, why do they have to have it? For the same reason.
Mm-hmm.
Because that's their mode of instruction as well. And believe it or not, when you give a device to a pre-K student, to a kindergartner, they can go in, they can show you how to get to Google Classroom.
They sure can.
They can show you how to navigate through that device with that device on how to get to their assignments. They've been trained by their teachers, and so that's why the first couple of weeks of schools were so important.
They were. And it's exciting to see the 4-year-olds with their devices.
Yes.
They've even taught me a couple of things about these smart boards.
Mm-hmm.
I mean, they're picking it up
Yes.
faster than us. So let's continue to talk a little bit about Raylo and how it actually works. Is there a demonstration that we're going to have?
Yes. So now we will do a demonstration on how to access the Raylo. Okay. So now we're at the point where we will now demonstrate for you the Raylo process. And so we will first start from, as a parent, I will go to the website that says Reopening of Schools. I will click on the website. And then I will look down under the Reopening of Schools tab till I get to the place that says Remote Alternative Learning. Click once. Once you click on the Remote Alternative Learning process, it will give you an announcement, and the announcement basically re-emphasizes the groups for which Raylo is appropriate. So you have the high-risk students in grades K through 12 due to COVID. You have the homebound students, and then you have students in grades 8 through 12 who are under our Virtual Learning Academy management process with Policy Code 3102 with virtual public schools. And we also have Edmentum that's housed there as well. So as a parent, the first thing you do is you download the request form. And once you download the request form, it will give you all of the demographic information, or it will ask all the demographic information that we would need in order to consider your Raylo request. So for an example, if you were asking for Raylo under option 1, which deals with COVID, we would probably ask you some questions like, how does your child self-identify as high risk from COVID-19? Is the student in isolation or in quarantine at this time? And what is your concern? Just to give you some background on that information. Once you have completed this particular packet, and if you note, this packet consists of actually 2 pages that you have to complete, and 1 page is an informational page. We will then take that information and we will go back to help you understand the process. We'll go back to the home page just so you can see the process map. Under the process map, we have things identified, like the parent identify the needs for assistance. And when you identify the need for assistance, it talks you through the process map as to what happens behind the scenes. Okay, so now let's just say that you've identified your need for assistance and you have completed the packet and we have the information for the school. The committee then meets. After you submit your request to the school administration, the committee meets and we have a process map for that. And then you will be notified of the decision. And it's a process map for that as well. So if we go back to that base page, you have the parent identify the need for assistance. The parent or guardian submits the requested information. We have the meeting day. And then we have the rollout of the decision. So let's just say that this is a candidate for RALO. When we do that, now the student is ready to assume the instructional part. So the student and parent are both ready to assume the instructional piece. So what happens next? The teacher is then notified of the information, and the teacher sets up his or her classroom to accommodate that particular RALO. So let's go back. Let's say, for an example, if we have a student at Aurelian Springs, and as a parent, I would like to figure out what it is that my child would do at Aurelian Springs. Well, there are one of two ways that we can do this. As a parent, if I was just going straight from the district's webpage, so let's just get back to Halifax County Schools webpage so I can navigate you through the entire process. We're at the district's webpage. I will click up to select the school. And the school that my child is at for this particular sample is Aurelian Springs Institute of Global Learning. So I will click on that, and it goes to the school's webpage. My child's teacher name is Miss Kiva Lynch. So I will go to teachers, and I will go all the way down to Miss Kiva Lynch's class. Now, all of our teachers have web pages. And these web pages outlines the expectations of the teachers as well as introduce you to the instructor of the class. So you will see a picture of Miss Kiva Lynch. You will also see the daily schedule. So let's just see if the schedule is coming in. So you can set this up at your house with the daily schedule. But you also see a copy of Miss Lynch's syllabus. So let's just say my child is in the 5th grade. And this RALO is for a 9-week period. So under Ms. Kiva Lynch's 5th grade class, under her syllabus, you will see expectations in terms of a traditional classroom, a virtual classroom, but you will also see information as it relates to what the students will be doing in Ms. Kiva Lynch's class. So let's see if I can extract that so you can see it. Okay. So now we have the full syllabus in its entirety. And whoa, look at that. You have the standards that the students will be introduced to, that they will have during this RALO period. And if you are the parent and you're instructing your child at home, you would just click on that particular standard. Okay. And this particular one is on making inferences. So, and you will go through and you will just play this particular thing for making inferences right now, okay? So, let's just say you are the student and you are in Miss Kiva Lynch's class. If you are the student and you're in Miss Kiva Lynch's class, the student will log into his or her email and go to his or her Google Classroom. And there you will see that Ms. Kiva Lynch's class is showing up here. So the student will log on that and voila, you have a list of the assignments that Ms. Kiva Lynch has for her students. This is what they will be expected to do on a daily basis. So ladies and gentlemen, once you complete this, you would have completed your assignment for that day or that given period of time to satisfy the Raylo criteria. Now, let's just say that we were at a secondary school, and for this particular one, I would choose Southeast. So as I go to Southeast's webpage, I would go under teachers, and I think the exemplar that I would like to highlight for this particular one is Miss Tamara Hall's class. So you have Miss Tamara Hall. She has her information here, and you can see that she has her syllabus for the respective sciences that she has for these particular classes, as well as her daily agenda. And we can just click on that so students will know the time frame. And give that a moment to populate. And then she has the Google Classroom pages and meeting links. So if you're in her physical science, first block, second block, very self-explanatory. It gives you the join code for those respective classes. Okay? And for the assignments, if I was the actual student, the student would go to his or her email address, would click over to their classroom for the Google Classroom, and let's just see if we can get Ms. Hall's information up. So let's go back to my Google Classroom, and you can see that I have Ms. Tamara Hall as a physical science teacher. And I will click on that information. And you can see she already has the assignments posted. So the students will be expected to do a quizzes for this particular class. This is where they will turn in their assignments. This is where they will mark it as done. And then this information will then be populated to the teacher to denote that this child has completed this particular assignment. So there you have it, ladies and gentlemen. That is Raylo.
Welcome back to Sweet Tea with Dr.
C. Yes.
I hope you enjoyed our first segment.
Mm-hmm.
But Dr. C, I am always on the school buses. We're highly visible as a team. And, during my travels throughout the district, I'm always stopped and asked a lot of questions.
Yes.
So I want to take a few moments to answer some frequently asked questions. Now, we're preparing our FAQs, and they will be posted shortly to our district website. But here are some questions that I've been asked often. Dr. C, can you shorten the school day? Great question. But no, there is a state law mandating the minimum number of student instructional days or hours. That's 1,025 instructional hours. That's a law. Another question that I'm asked frequently, how are you reducing possible exposure during eating periods and bus rides? Hey, that's a great question. But I want the community to know that our practices are aligned with the NC Strong School Toolkit. Students are being, and we're also discovering new ways to keep ourselves, safe. For example, students are now being seated face to back. I want you to imagine that, face to back. Remember, we're eliminating the spread of those droplets. We're also in the process of purchasing seating mats and benches so students can enjoy the outdoors while they eat and congregate. Another question that I'm being asked is, what is the difference between isolation and quarantine? Wow, now I had to learn this one myself during a time when all of the doctors and the health directors were online. Dr. Battle, you were in that meeting. And I said, well, what's the difference? Well, and there is a difference, and we need to learn this. Isolation separates sick individuals with a contagious disease from people who are not sick. Quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. So one is sick, and the other is if they become sick, where you're being monitored to see if you become sick. So we can quarantine individuals. Does not necessarily mean that they're isolated. And we have a very special guest with us. Her name is Dr. Anita Jackson.
Yes.
And she is going to join us shortly, and she is going to help clarify all of these medical questions, because Dr. C, my expertise is teaching and learning, right? So I believe in swim lanes, and we follow we stick to the level of our expertise. And what we did was that we've asked Dr. Anita Jackson to come and join us today to talk about COVID and what we're doing. And before I bring her on, I want to just remind you that safety is a feeling. in Halifax County, and we want everyone to feel safe. We want everyone to feel safe so that we are ensuring that our staff and students are safe, and we are working hard. We're working hard to keep a safe, positive learning environment.
Yes.
In July, we put together a lot of processes and protocols in place. You now know how to access our reopening of schools webpage. One of the safety protocols that we've also implemented as a fourth layer to keep us all safe is our COVID-19 testing for all students and staff with written consent. And next, to explain it, we would like to welcome to Sweet Tea, Dr. Anita Jackson. Hi, Dr. Jackson.
Hello, Dr. Jackson.
Thank you, Dr. Battle and Dr. Cunningham. It's a pleasure to be here.
It is.
I am so excited that Halifax County schools are really taking the lead in surveillance COVID-19 testing for all students, faculty, and staff. And we want every parent to get on board and join us in keeping the entire community safe. Have student leadership and have your students tested every week. So what questions can I answer for you and your entire team?
So first, before we do that deep dive into COVID, I want to tell you a little bit about Dr. Jackson because, you know, we're an educational community. Dr. Jackson is the lead advisory member of the COVID testing team for Halifax County Schools.
Woo!
Listen to this. She is the first African American female board certified, now here's your word for today, otolaryngologist.
All right.
But you know him better as an ENT surgeon in the state of North Carolina. She identified one of the first COVID cases in the state of North Carolina as the medical director of the Durham County Department of Public Health. She helped to design the successful school reentry for the North Carolina School of Science and Math in August of 2020, who continues to have a successful COVID surveillance program with nearly, listen to this, the North Carolina School of Science and Math. They have a program with nearly 100% of students tested weekly or bi-monthly if vaccinated. Dr. Jackson sits on the state's COVID testing advisory work group and is a subject matter expert on COVID testing and equitable COVID recovery in historically marginalized populations like Halifax. You know, so Dr. Jackson, how are you? I know you just wanted to jump in there and help everybody, but Dr. Jackson, tell us a little bit of, well, first of all, before we get into COVID, if you don't mind, I'm going a little bit off script because I can do that. Dr. Jackson, tell us a little bit about your love for medicine and how you became the woman you are today.
So, you know, people always ask, where do you feel most comfortable? So I am always most comfortable in the poorest, most needy community because that's a community I grew up in Augusta, Georgia. You know, the single daughter of a elementary educating mother and a father who was 38 years in the Army. And my aunt was a superior chemistry teacher. So my aunt was always my babysitter. And so I learned a lot about chemistry, even in elementary school. And so I've just absolutely loved science and found that medicine was the way for me to express science because it's through science and really the discoveries of science that we've learned how to best treat people with humility and kindness and compassion and how to heal them. So I am passionate about science. I think all physicians are physician scientists, which I learned from my mentor, Dr. LaSalle Lafau, who always says equanimity under duress, right? So anybody who went to Howard will know that slogan that we want to keep our cool when others around us might lose theirs. So that's really the testament of what the COVID pandemic has been for the entire United States, really for the world, that we've seen the all of the outbreaks, but we've seen countries who've been able to keep their cool, move science forward, and help communities engage in their own recovery do the best.
Oh, wow. So you know how we are in Halifax. We don't guess. We go out and get the best.
5-star.
Well, we get a 5-star here. Someone who's striving for 5 in their profession, and then we say, come and help us. and we create our partnerships, which is part of our mission. See, we know that to address the needs of the whole child, we must create partnerships, right?
Partnerships.
That creates a supportive and positive learning environment for all of our students in order for them to be successful global citizens. So, Dr. Jackson, please tell us a little bit about One Love Lab and their partnership with Halifax County.
Absolutely. So One Love Lab is one of the few African American owned and operated high complexity labs in the state of North Carolina. They were the only lab in the state who actually started doing COVID testing when schools reopened in March of 2021. And they started in their hometown of Bertie County. And so I thought with their experience, they would be perfect for Halifax County. Why? So not only do they have an owner who looks like most of the children from Halifax County, but their owner is from a neighboring county. And I think it's very important for the children to see other COVID testers who look like them, who are part of their community. And what we have found over using labs across the country, really, that a lot of times labs want to bring science into the community. We want to grow science within the community. We want the entire community to be a part of the science of COVID and a part of the scientific solutions of COVID, as well as have some entrepreneurial equity around what's going to be our new COVID normal. So One Love Lab was a great choice, I think, for Halifax because they're part of the community, they're committed to the community, and they look like the community they're serving.
Hey, well, that's all right.
So when you think about that and you think of the service work, because earlier we talked about the students who were working with us, why is testing so important?
Testing is superiorly important in trying to mitigate this virus, right? All viruses want to find a human host to survive. So we need to be able to shut down those pathways, and testing allows us to identify the pathway of the virus. It only works, surveillance testing only works if we all participate. Right. If only a selected group participates, then it's selective testing. What we want to do is we want to have everybody involved, we want to be inclusive, and we want to be able to track and actually block the pathway of the virus throughout any school, throughout the entire school district, and we can do that with all of your help.
So what are some examples of the tests?
So there are three types of COVID tests, really. There's the antibody test, which we know is the PCR test. That is the most accurate. Many of you will hear that PCR is always the most accurate test. There's an antigen test that really looks at proteins, and often the antigen test can be fast, but it can be 65% inaccurate. And so we only recommend antigen tests, on-the-spot antigen tests, if you are symptomatic. If you're asymptomatic, which is what 95% of students are, young people are asymptomatic positive, they will always need a PCR test to confirm whether they're positive or negative. The third type of COVID test is an antibody test. And the antibody test will tell whether you've had COVID. It'll also tell you whether you've had the vaccine. And it can tell you whether you have neutralizing antibodies to the virus. Unfortunately, the antibody test has not been able to tell us quantitatively, how many antibodies we need. And so it's got some limited use in its effectiveness.
So you gave us the different kinds of tests, and I guess in your description you talked about the test being effective. Can you elaborate on that a little bit more and tell us how long does it take to get the results?
Absolutely. So the PCR test, which is the gold standard for COVID testing, takes about 24 to 48 hours to get the result. It is a molecular-based test that looks at snippets of the RNA of the virus. And so that's why it's the most accurate. It is very hard to ever duplicate this test to make yourself positive. So a positive is a positive is a positive in a PCR test. Now there are things you can do to manipulate the test, and so we always try to make sure we get the test at the start of the day, before you eat, before you drink anything, or 30 minutes after a meal. We ask not that you're using mouthwashes and toothpaste right before your test, because we don't want the test results to be wrong. We want them to be right. And there's no reason to be afraid of the test, because the test is something we should all do. We should do it as often as we brush our teeth. We should test so that we can keep everybody safe.
Wow. Now, how does one sign up for testing?
So through your school district, through Halifax Schools, there is a consent form at every school with all your school nurses and probably with your teacher. And so all you have to do is sign up with your teacher. And for parents, just reach out to your teacher or the principal and say, hey, I want to be a part of the Halifax School District's COVID testing team. I want to do my part. My child wants to do their part. And we are part of the COVID testing alliance, so that we want to make sure everybody gets tested every week.
Wow.
Does the test hurt?
It doesn't hurt.
You sure it doesn't hurt?
I'm
Because I've
positive.
heard about that nose swipe and going up in my cranium.
So
Do a demonstration.
no, why don't we all do a
Yes, let's
demonstration?
do
Here's
one.
one for you, and here's one for you. So we want, the other reason that we felt like One Love Labs was so innovative is that they are using this oral swab PCR based test.
Okay.
So this swab is so gentle, it goes in your cheek. You just open up the package and you can see here, here's a nice flat soft swab. You can then take out your collection tube and open the collection tube with the other hand. And the goal of the test, Dr. C, is to take the swab, Dr. Battle,
Okay.
swab it in your cheek and get it as moist as possible with all the saliva you can possibly do. Are you ready?
Mm-hmm.
I'm gonna count to 3.
All right, let's go.
1, 2, 3.
Ah.
10 times on each side, under the tongue, get it as moist as possible. Get all of that spit, and then once you finish,
Have fun with it, kids.
have fun with it. Not on your teeth, just in your cheeks, under your tongue.
Mhm.
And then you're gonna cap it together and you're gonna seal it tight. You'll seal it tight, and as you will see, Dr. Battle and Superintendent Cunningham will then place it in their respective biohazard bags, and it will be ready to go. So it's as simple as 1, 2, 3. As the kids say, easy peasy. It's so easy, even a 6-year-old can do it on their own.
Right.
And this is the type of test that we're asking all students in Halifax County to do each week. And their results will then be texted to their parents, the negative results, every other day. And positive results are always called. So you get a phone call from me or another physician, then you know that you need to talk to us about having your student isolate and keeping them safe and keeping all the community around them safe.
So only positive cases will be contacted.
Only positive cases are contacted, and if you don't get a call, then you know you're clear that week and you are negative.
And just come on back to school.
Absolutely.
And see, that's the power of what we're doing.
Right.
We're keeping our environment safe so that we can learn. It's a good feeling. Remember, safety is a feeling. And I want everyone to feel that we're all safe every day in Halifax County. And I need every parent to know that we've taken every effort. We've gone as far as we possibly can go to ensure that we're all safe. And by COVID testing, we're able to segregate, right, Doctor? We're able to segregate those who are positive and those who are negative.
That's exactly right. And we are able to keep that classroom COVID-free as early as possible. It will take all of us to really win this fight against this virus, and we're all in it together. So please sign up your student. Halifax County is really leading the way. I'm so proud of both Dr. Cunningham and Dr. Battle for their leadership. And in fact, I just think that you guys are doing a terrific job. You will be the model school for all of the 100 counties in North Carolina, and I want to thank you for doing that and for leading the way.
And we thank you, Dr.
Yes,
Jackson,
absolutely.
for joining Sweet Tea with Dr. C. Dr. Jackson, before we close, one more time, because I'm just fascinated. You know, Dr. Jackson is a lighthouse. See, we that's what we call experts in this field.
That's fine.
And we want others to draw to that light. Tell us a little bit about your med school preparation. How did you become Dr. Jackson? You had to go to undergrad, grad. Walk us through the steps.
So most of my friends would say that I was a professional student, and I think that Whenever you embark upon doing a profession that helps people, you never stop learning. So first get in your mind that school is fun. My mother used to say, as long as you stay in school, you won't have to pay any bills. And that's almost true, except you end up having to pay a lot of school bills. I did my undergrad at Princeton, and remember, I was just a little country girl from Augusta, Georgia, and then I thought I wanted to be able to do research science. So I went to Stanford to get a PhD, and unfortunately, I got bitten by one of my lab rats. So that then turned me towards humans, so that I felt like humans wouldn't bite. And then I went to medical school in Chicago, which I loved, but it was way too cold. And I did my general surgery at Howard, which I loved, and my otolaryngology at the University of Tennessee, Memphis. So I've had quite a career, and in between I got an MPH from Harvard, which I'm very, very proud of, and just recently got elected to the Alumni Council for the Harvard School of Public Health. So I'm delighted to be able to say that I've been in school forever, and would love to continue to learn, and certainly Halifax County is giving me an opportunity to do that through this pandemic. So thank you very much.
And thank you, Dr. Jackson. And you know, Dr. Battle, we turn every challenge into opportunity. So we're taking the challenge of COVID. We're developing a 4-pronged strategy, but we're also utilizing the testimonies of our new partners to light the pathway. So now, scholars, you now know what you have to do to become a lighthouse like Dr. Jackson. Is it impossible, Dr. Jackson?
Absolutely not.
No.
If I can do it, anybody can do it.
You just have to be resilient. You have to study hard. You have to be serious about it. You have to grind. All of the things. Be ready, respectful, resilient, triumphant, proficient.
Absolutely.
Those 5 prongs that we preach every day in Halifax County Schools can help you realize your dream big. Again, thanks, Dr. Jackson, for joining Sweet Tea with Dr. C.
And Dr. Cunningham, you know, you asked her, you said something about whether or not it hurt. Did it hurt you?
No, it didn't hurt at all. Didn't hurt at all.
So that's a good thing for our parents and our students to know, that we have their best interests at heart.
We do.
Always.
Yes.
Thank you very much, Dr. Jackson.
Thank you for having me, and congratulations, Halifax. Go get tested, and make sure you also get vaccinated to protect yourself and others around you.
Wow, Dr. Battle, we're having a wonderful show, aren't we?
We really are meeting the needs of everyone in the community.
Everyone in the community.
Right.
We started first by opening up with our 4-pronged test, our 4-pronged strategy to ensure that everyone is safe. We talked a little bit about, bus safety and how everyone must do their part to keep us safe. We had Dr. Jackson on talking about COVID testing, and she shared a little bit about her career pathway. Wasn't that awesome?
That is very awesome, and I think our students can identify with that because she really talked about that 5-prong that we aspire for when we talk to the kids about being resilient and proficient and triumphant and making sure that they live up to a 5-star life. So she really exemplified that, and we could see a real life example.
Yes, we did. And parents, students, everyone, you now see a pathway. And so now we've learned about the COVID test. And now we have our next guest right from the central office, resident operational COVID expert, Dr. Gregory Monroe, who's the Director of Human Resources and Operations. We formed 2 strike teams at the beginning of the year, right?
Yes.
Dr. Battle, we had one for remote learning and instruction, and then the second one was for operations. And Dr. Monroe is in charge of that 2nd strike force, and he's been working hard behind the scenes, learning everything there is to know about COVID and its impact and what we can and cannot do. Good morning, Dr. Monroe. How are you?
Good morning, everyone. Good morning, Dr. Battle.
Good morning.
Everyone.
And Dr. Monroe, we've been COVID testing for how long now?
We are in our 3rd week of COVID testing with our independent lab, One Love Lab. This is our 3rd full week of testing in all 11 schools.
Yeah, all 11 schools. And let's talk about the reporting. How are we reporting the results?
Once we get test results from one lab, they're uploaded into our portal, and our school nurses have access to those portals, and they can see which ones are positive. Now, what I've been sharing with some of the parents who have called is in instances where no news is good news, is if you don't get a call from One Love Lab, that's good. That means your child is negative. If the phone rings and it's One Love Lab, or a number you can't recognize, and they identify themselves as with One Love Lab, that's generally your sign that your child tested with us, and we have positive results. Now, we still do have some who are testing outside of One Love Lab, and the parents are then calling the schools and making them aware. Now, not that we don't trust our parents, but we also need to trust the science. So we ask that they send us the positive lab results so that we can confirm that they did test positive. And what that then does from either One Love Lab or from the other labs that they may test it outside. Why would you want to test outside when we're doing it in-house? But I pick up the telephone and I call our Halifax Health Department, either Regina Price or Miss Frances Vick, and I tell them these are the names. They have a database, and every positive case populates to a database. But if they test outside of Halifax, or if they're not a Halifax resident, we don't know if it's populated. So just to cover all bases, we report to our Halifax Health Department the names of those who have tested positive so that they can confirm them in our database. Right. We should even share the names of the ones who we get called about, but we don't confirm their positive case until we get those positive labs. The positive lab is the science that we validate our, and then we trust. We validate and then trust that what we're getting. Believe it or not, when we first started school, horror stories or funny stories were going around where kids were claiming to be positive just to get out of going to school.
2 weeks.
Yeah, that, or they were not a starter on the team, and so they would claim that they were positive, which means the whole team had a quarantine. So we validate and then we trust with regards to positive labs.
I like that, Dr. Monroe. I really like that because we always train our staff in documentation. So that's a good thing. So talk to us about the guidelines. After they get the positive testing, what happens next?
Positive test requires that individual to isolate. And isolate means that you are separate from anyone and everyone else, opposed to quarantine, which you're set apart. So if you have to isolate for a minimum of 10 days, regardless, any positive test that you receive requires you to isolate from the general public, remain in isolation, because you are you're actively able to spread the virus from one person to another through your droplets, close contact, and those particular things. So a positive case, a minimum of 10 days that you have to isolate without symptoms. At the 10th day, if you're not having any symptoms, you can end your isolation, and then you can return to the general public. The recommendation is that you still continue to wear your mask, because what many people don't realize is after your isolation and after you tested positive, you can continue to test positive for up to 90 days, because you now have the antibodies in your system. And so with One Love Lab, we understand at our schools that any of our students that have ended their isolation and have returned back to school, that we're not testing them unless they are showing symptoms again, because we know that if they test the very next day they come back in, there's a likelihood that they could test positive again. And we can't have a kid out 2 weeks, and that is something that CDC and the Strong Schools Toolkits and North Carolina Strong Toolkits reminds us is that once you test positive, you don't have to have a negative test to return back to school or to work, because you can continue to test positive up to 90 days.
So it's isolation, 10 days, no symptoms, return to school.
Right.
Repeat after me, family. Isolation, 10 days, no symptoms, return to school. See, that's the process. That's the positive process. That's how you come back to school. And that's how you keep everyone safe in your entire family. Now, when you're quarantined, what are the rules?
Quarantine is that you have been possibly exposed, and we don't have positive labs to identify or to confirm that this person has been infected with the virus. So with quarantine, you're isolating, you're separating yourself.
Mm-hmm.
You're following the guidelines, waiting 6 feet, washing hands, wearing a mask, and pretty much kind of keeping a barrier around you, or this invisible dome of silence that Maxwell Smart used to have to protect those who are around you, because at this point you don't know if you're positive. So quarantining is that you're just separating yourself away from those people. The guidelines doesn't preclude or say that you can't go out, but we're saying you shouldn't go out, because at this point you don't know if you're not. So then from between 5 and 7 days after being possibly exposed and being in quarantining, you should go be tested and to receive positive or negative lab results that you are either positive or you're carrying the virus, or you're not carrying the virus. And then, of course, if you're positive, then you go into isolation. You should not be around anyone, because you are actively contaminated with the virus, and you can spread it too.
So quarantine, you quarantine, which you're separated. You're separated. There's a barrier around you, and you're quarantined for 5 to 7 days. Then you need to get tested.
That's
right?
That's right.
And then based on the results, if you're negative, you return to school. Now, so parents, we need to understand the difference between the I and the Q. All right? The I and the Q. Because there's a difference, isn't it, Doctor?
There, absolutely. Isolation means that there is a positive case and that this person can actively give the virus to someone else. Quarantine is, there's a question mark about whether they have been infected or not. And so you should use all the universal precautions, waiting 6 feet apart, wearing your mask, even around those who are fully vaccinated, or those who have previously been tested positive and have recovered. Because again, you can continue to pass the virus back and forth, and you can be asymptomatic and not knowing that you are unconsciously giving this to some people. And we know that we still have vulnerable citizens that can't be vaccinated, or they have low immune systems, or other things that could impact them greater than it is impacting you at this time. You may go, "Oh, I had it and I felt fine," but we don't know that's what's going to happen to our grandma, or cousin, or our aunt, or uncle, or cousin that we may pass it along to. Everybody's system is different.
And we're trying to protect everyone in the household.
That's right.
We're trying to protect mama, daddy, grandpa, grandma, everyone. And that's why it's so important that you know your status.
So when you think about that, and I'm reminded of the various conversations we've had around the community, in our schools, in our social media, a lot of times we see things posts that people have. We want to know when will the schools shut down. So earlier we talked about Senate Bill 654, and we talked about that brief period of closing out for like 2 weeks, or maximum of up to 2 weeks. But talk to us about when can we shut a school down? Well,
the guidelines out of Senate Bill 654 gives us 3 reasons in which we can shut a school down. Is one, that we have insufficient staffing, that we don't have enough staff because for whatever reason related to COVID, or that we have a significant spread of the virus amongst our student body, or the campus. I won't just say students, because it could also be staff as well, or both. Those are the only 3 reasons that we can revert to or shut schools down related to a COVID emergency. And then upon doing that, Dr. Cunningham, or his designee, we have to let the state know that we had to close a school due to one of those 3 reasons with regard to that. And so just to kind of paint a better picture of what it would take, for example, if I were to look at one of our larger campuses, and they have about 300 kids on that campus, our health department has helped us define significant spread. So we're saying 10% of that campus student body staff, if within a 2-week period that we had 30 cases, we should shut it down, disinfect it, just do deep cleaning day in, day out to make sure that campus is safe, revert to remote learning for all of our students, revert to remote for our teachers, so that we can return students back to that campus and staff back to that campus. Now, the key thing is when you're looking at clusters, a cluster is 5 or more that are linked to each other. Mm-hmm. So if I have it, and then I give it to Dr. Cunningham, and then he gives it to you, then that's a linkage. And because we were all in the same classroom together, we were on the same, bus together, and we can link it to each other. And what people are seeing when they see our numbers is, oh, that's more than 5. Well, they're not linked together because I got my virus from my uncle who tested positive. She got her virus from her daughter who tested positive. And we don't live in the same household. We're both on the same bus or we're both in the same classroom, but our virus contamination or linkage is not linked together. And so that's when we have to consider that we ask these behind the scene questions. So when we get a positive case and or the nurse calls and says, we have this student who, okay, where, where their exposure come from? Was it tied to someone? Did they have to quarantine because they were possibly exposed to somebody in their classroom? No, this was, so we ask those questions to see if we got linkage first. Mm-hmm. Are we within a 2-week window period, 14 days, that we've had these outbreaks? So, we started school August 23rd. That week, and all those numbers, those are off our case because they finished their isolation and quarantine, and so we can't count them anymore. But last week and this week, we're still not at a 10%, or we don't have a cluster, that is linked together. So there's a lot of questions we have to answer in order for us or for Dr. Cunningham to tell the board that we have to shut things down. And a lot of that comes out of Senate Bill 654 because they want to keep students in-person learning because we know that's how our students learn best.
That's good stuff. That's good stuff. So we have 10%. So here's an example, as Dr. Monroe said. We have 300 students at a school. We're testing weekly. Within a 2-week period, if we have 25 positive cases within a 2-week period, that did not meet the 10% threshold.
That's correct.
So we continue to move. Once we get up to 10%, which would equal to 30 positive cases within a 2-week period, I'm going to shut the school down. I'm going to shut the entire school down for up to 2 weeks. And we're going to go and kill that virus every day. For 2 weeks, we're just going to put a full court press on that virus. Sanitize, 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 sanitize. And we're going to go around that cycle 10 times. And then we'll reopen the school again in a safe and orderly way. Now, when we do close down, we will communicate all of this important information. But before I tell you, let's just talk about social media. Families, if you want to know what's happening in Halifax County Schools, you need to come to our social media page, our Facebook page, our Instagram page, and our web page. Halifax County Schools, we're the authoritative source of the right information. Do not go to other web pages, other Facebook pages, other commentary pages to talk about what's going on in Halifax County Schools. I've always been a transparent superintendent, and I will continue to put the information out there. But sometimes, I do it on Sunday too. I play armchair quarterback. I'm always sitting in the game, I can always win the Super Bowl after it's been played, and we're playing armchair quarterback and we're second guessing. But as you can see in Halifax County, we're bringing in the superstars, the heavyweights. Dr. Anita Jackson, One Love Lab, Dr. Gregory Monroe, Dr. Battle. We're bringing in Mr. Bruce Robusto. We're bringing in the heavyweights, those who have spent their entire life studying the field. And those are the people we should listen to during this time. So I'm asking you, look at other Facebook pages for what they are, entertainment. That's what it is, nothing but entertainment, social entertainment. But when you want to know the facts, you come to the authoritative source, Halifax County School District webpage, our Facebook page, our Instagram page. Our press releases are released weekly throughout the area, correct, Dr. Monroe?
Yes, sir.
And our press releases shows how many cases we've had for the week and what we're doing. Our principals are doing automated calls on a regular basis
Yes.
about what is happening in their building. So you are receiving on-time information regarding the status of Halifax County Schools. So clear your mind of all that outside noise so you can hear us when we call. I'll say it again. Clear your mind of all that outside noise so you can hear the Halifax County School voice when it calls. And I'm going to go back to what Dr. Jackson said. She called it equanimity under duress. And I thought about that. Equanimity means balance under the most stressful times. Families, we must learn to keep our cool even in the hardest times. We can't let anger divide us. We can't, inflammatory rhetoric, it will only separate us. We all must take deep breaths, calm down, and believe that Halifax County Schools has your best interest in mind. I am committed, and I am convinced now, after being here for 5 years, and I'm going to say this the way Shaka Khan said it.
Yes.
Y'all remember Shaka Khan? Shaka Khan? Ain't nobody gonna love you better than Halifax County Schools. Ain't nobody gonna love you better than Halifax. And I mean that. I know that. So check out our school, our social media page. Our reopening page, as Dr. Battle showed you earlier, is on our district webpage. Click on it. Make sure that you're listening to our parent link calls as well as our student emails because we're blasting information out to everyone. Together, we're making a difference in Halifax County Schools. Together, we're maintaining a safe and orderly environment for everyone. Dr. Battle, talk a little bit about our reminders.
So, parents, as we are reminding you that we are in this together, we want you to continue to sign up for the COVID testing that we have coming up. So if you have not done that for your scholar, please make sure you do so. We want you to continue to wear your mask as you're entering into the Halifax County Schools facilities. We want you to socially distance to the greatest extent possible, wash your hands, and by all means, stay safe and listen to the authoritative data source.
That's right, and that's Halifax County Schools, where no one will love your child better. We actually love you too, Mom and Dad and
That's
Grandma,
right.
Grandpa, Auntie. We love you too. We are one. We are family. I want everyone to stay safe. Dr. Monroe, thank you very much for the way that give Dr. Monroe a round.
Good job.
He's becoming the COVID czar in Halifax County, and we want to say thank you very much. And thank you for joining Sweet Tea. Have a great day and continue to strive for 5.
Strive for 5.